We will talk about urticaria. It affects around 20% of world population. It means it's extremely common. And what means urticaria? It is red itchy welts on the skin. You can see they are different shapes and different size welts or patches on the skin, which develops very quickly, suddenly, and they disappear also suddenly. It is called urticaria or hives. Usually it looks like food allergy. Here is common scenario. Person eats food, usually it can be nut or egg or sea product, and after this on the skin there is allergic reaction, and this allergic reaction causes red itchy welts, and these different shapes. It can be larger, size of palm, or it can be smaller, less than coin. So they can be different shape, and primary symptom is itchiness. So itchiness, very important symptom. Itchiness after eating specific foods is usually urticaria. Is extremely common condition. And what are the triggers? Triggers usually are foods like eggs, nuts, milk, chocolate, soy, berries, sometimes medications, and even non-steroidal anti-inflammatory medications can trigger urticaria. Cold or temperature changes, or stress, or different environmental factors can cause urticaria. Even touching can cause urticaria, and it is called dermographism. So urticaria is extremely common allergic reaction, usually on foods. And here is mechanism of action. When there is trigger usually is food. It activates mast cells. Mast cells are like soldiers for our immune system. They are mast cells. It activates mast cells, and these mast cells release histamine. Histamine are small molecules, and these molecules act as an inflammatory agent, and they start inflammation process. They dilate blood vessels, and when blood vessels are dilated, fluid leaks from blood vessels, and we have swelling, and we see swelling. We see redness because this dilated blood vessels, so we see swollen and red welts on the skin. And why it's itchy? Because histamine irritates nerve endings, and we have feeling of itchiness. So everything is on histamine. Key player here is histamine and mast cells. Also, it's very complex mechanism, and there are many cells, many types of cells, many types of reactions, but key players, most important players, are mast cells and histamine. And why is urticaria important? Because usually urticaria will goes away itself without treatment in several days usually. But why it's important, or to what we should need to pay attention? People who have urticaria have increased risk of autoimmune disease such as thyroid disease or rheumatoid arthritis or other types of autoimmune disease. Also increased risk of allergy, asthma, or anaphylaxis. That's why we should be careful. When person has urticaria, it means that he is prone to allergic diseases and autoimmune disease. That's why we should pay attention. If person has urticaria, it means that we should pay attention, because this person can have autoimmune disease or, in rare cases, anaphylaxis, and anaphylaxis is life-threatening condition. That's why we should be prepared. So usually prognosis is very good for urticaria. It will go away on itself. It cleans up within a few days, sometimes few hours, sometimes few weeks, sometimes few months. It is called chronic urticaria. And what is complication of urticaria? Complication is angioedema. Angioedema is when this inflammation and this swelling spreads under the skin also. And very common scenario of angioedema is when person's face is swollen and their lips is swollen after eating, and sometimes their throat is swollen and difficulty breathing, and it is life-threatening condition, and we need to act rapidly at this case. And sometimes urticaria provokes anaphylaxis. Anaphylaxis is systemic allergic reaction when not only skin is involved, but also whole body is involved, and blood vessels are dilated in whole body. We have dropping blood pressure in whole body because fluid leaks from these dilated blood vessels. We have low blood pressure, and we have person can collapse at this case, and also we have bronchoconstriction or swollen throat and difficulty breathing, and person can stop breathing because this obstruction, and person can choke because this bronchoconstriction and swelling throat. So anaphylaxis is medically emergency, and we need emergency treatment at this case, and only treatment here is epinephrine injections such as EpiPen, for example. And person who is prone to anaphylaxis and urticaria, and if person had such cases of anaphylaxis, you should be prepared at this case, and such person should be prepared with EpiPen or epinephrine. It is epinephrine is hormone actually which causes constriction of blood vessels, so pressure goes up, and bronchodilation, it means it dilates bronchi, and it decreases swelling, and person can breathe freely. That's why epinephrine is very important drug at this case. So what is the treatment of urticaria? For urticaria, treatment is non-sedating antihistamines such as loratadine, fexofenadine, cetirizine. They are very effective. Usually they are first-line treatment. Usually this first-line treatment is enough and no need another treatment, but many cases higher doses are indicated and higher doses are prescribed compared to general usage of these drugs, because urticaria is a more severe reaction, allergic reaction. That's why it requires sometimes more aggressive treatment. If first line treatment fails, then second line treatment is used. Second line treatment can be H2 blockers such as famotidine or ranitidine. They can have some effectiveness but mixed results. And prednisone is important steroid, anti-inflammatory steroid, which should be used only short term because of lots of side effects. It's steroid, oral steroid, so prednisone is last resort if other treatments fail, but you should use them only for several days. It's not allowed to use for prolonged period of time because it has serious side effects. As a home remedy, cold baths is effective. It suits skin. Oatmeal baths also, you should pour some oatmeal powder into bath, and oatmeal bath also suits skin. And calamine lotion is also effective during urticaria. That's the treatment if there is anaphylaxis. So anaphylaxis is not urticaria, but symptom of anaphylaxis can be urticaria. So anaphylaxis is much more complex, much more systemic reaction of our body. That's why each symptom can be urticaria, but urticaria does not mean anaphylaxis. Urticaria can trigger anaphylaxis, but anaphylaxis is more complex condition. So urticaria can trigger anaphylaxis, urticaria can trigger angioedema. Angioedema is milder form of anaphylaxis, and more mild form is urticaria. Urticaria is most mild form. More severe form is angioedema, and more severe form and more systemic form is anaphylaxis. That's a correlation. So epinephrine is effective treatment for anaphylaxis. And what is prevention? Prevention is identify and avoid known triggers of urticaria. That's the prevention. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.